Is this the end of Medicare Advantage as we know it? Maybe. So Medicare Advantage is actually a great idea with an arguably flawed execution. Now, I'm not going to get into the why too much in today's video because I'd like you to actually stick around to the end of the video. But even though Medicare Advantage plans as we know them are relatively new, privatized Medicare plans have actually been around since the beginning of original Medicare. Now, in the beginning, these privatized plans were really just a way to bridge the gap between the group health insurance that people had and their now Medicare, and allow them to perhaps continue to see their regular providers. Over time, it evolved to serve the specific needs of a specific community and expanded to offer additional benefits. This is more like the Medicare Advantage that we know today. However, there are definitely major problems. And despite these major problems, Medicare Advantage plans are actually now so popular that over half of Medicare beneficiaries are enrolled in a Medicare Advantage plan as opposed to original Medicare. Now, while there are many positives to Medicare Advantage and many benefits, which we are going to talk about later in the video, the reason that Medicare Advantage plans may be so popular could actually be rather nefarious. So when you enroll in a Medicare Advantage plan, the government is actually paying that Medicare Advantage plan to take on your medical risk. To the government, you are a risk, and a rather expensive one, that they would rather be held by a private carrier. Now, these Medicare Advantage plans make major profits, and to do so, they are heavily marketed. But not only are they heavily marketed, but many agents and brokers actually push Medicare Advantage plans because the commissions are often much higher. That being said, most of our clients still choose Medicare supplement plans as opposed to Medicare Advantage plans. But anyway, if you follow the news, you're probably aware that Medicare Advantage has become a rather contentious issue. Restrictive networks can leave a vulnerable population often having to travel extensive distances to have their medical needs met. Also, there is the major issue of pre-authorization, which is always an issue with Medicare Advantage plans because they are managed care plans, which can sometimes lead to denials or at least delays of life-saving medical treatments. Additionally, with so many hospitals and doctors abandoning the Medicare Advantage ship left and right, it's leaving many Medicare Advantage beneficiaries feeling bamboozled. So what is the answer? Are there changes on the horizon, and are those changes the end of Medicare Advantage? Well, maybe. Now, a brief pause here. If you like what you're seeing, and we hope you do, please make sure to click that like button and also subscribe to stay up to date, because as you can see, there are constant changes in the world of Medicare. And of course, if you have questions about anything Medicare related or health insurance in general, you can reach us in the comments below or at the number on the screen. We are licensed nationwide, and there is absolutely no charge for our services. Now, should Congress choose to take action, there are two paths really that they can follow. The first of which is just to improve original Medicare and make it more competitive. One of the reasons that so many people flock to Medicare Advantage plans are the additional benefits offered. Things like dental, vision, hearing, and prescription drugs. These are very, very important benefits that are not offered by original Medicare, and they're not offered by Medicare supplement plans either. Now, of course, you can get prescription drug coverage with a Part D plan, and you can purchase dental insurance, vision with some type of private insurance plan. But this is pretty complicated, and sometimes it's expensive. So as a result, many times people choose the easier, simpler to understand, more all-inclusive approach that is Medicare Advantage. There have long been cries to improve original Medicare by adding in some of these benefits. Now, if original Medicare were more competitive when you compare the benefits to Medicare Advantage, more people might choose to stay with original Medicare. And why do we care about that? Well, although Medicare Advantage plans must offer at least the same benefits as original Medicare, there are differences between original Medicare and Medicare Advantage. For example, there are no networks with original Medicare. If your doctor accepts original Medicare, and almost all do, as well as almost all hospitals, then you can see them without issue. There's also no need for a PCP or referrals to see a specialist, and there is no pre-authorization. But that's not the only way to address these issues with Medicare Advantage. If there were more competition amongst the Medicare Advantage plans themselves, that could also rectify the issue. So I'm going to take you to an article by Healthcare Innovation to discuss it a little further. So the alternative to making traditional Medicare more competitive, which is what we already spoke about, is to rely more exclusively on insurer competition within Medicare Advantage. That's the first thing. And on direct regulation to make Medicare Advantage perform well as a dominant standalone program. So that's going to require significant more input from the government. Although instilling more competition within Medicare Advantage may be a worthy policy goal, which it certainly is, policymakers and antitrust authorities in the United States have struggled to make healthcare markets more competitive. Absolutely. Now, as for regulating Medicare Advantage without a traditional program, the challenges are not insurmountable. It says here benchmarks could be set differently and administered prices could be imported from traditional Medicare. So they're still going to be using basically the original Medicare model for Medicare Advantage. Premiums could be capped and benefits could be standardized. So you would be much easier to shop like it is with Medicare supplement plans because those benefits would be standardized. Stricter measures could be devised to discourage overly restrictive practices. Some of those overly restrictive practices that we already talked about, restrictive networks, pre-authorization, etc. However, there are risks. So if the benchmarks are no longer basically related to original Medicare and instead based on these bids, they could increase in the markets that have little competition, so no good, which would act to increase Medicare spending, which obviously we don't want to do because Medicare is already running out of money. And then there's other things. The pre-authorization practices and networks are hard to define and monitor. So it's not like you can say we set, if you were to compare it to premiums, it's very easy to say the maximum premium that you can charge is this, or deductible. The maximum deductible you can charge is this. But it's much harder to set benchmarks and to really monitor the size of networks and pre-authorization practices. And then this next paragraph is really where the whole "is this the end of Medicare Advantage" concern comes in. So rebalancing the programs by means of cuts alone would entail a drastic reduction in payment to Medicare Advantage plans, probably 15 to 20% more, which would decimate the plans quite a bit, which would result in substantial losses for enrollees, obviously. So basically, we can't rely on just cuts alone. The approach must couple an increase in the generosity of traditional Medicare coverage, which increases Medicare Advantage, with the offsetting the decrease in Medicare Advantage subsidies. So basically, if they're not just going to increase the benefits offered by original Medicare to make it more appealing, they're going to have to be a combination of cuts and increases in order to fix the issues with Medicare Advantage, as well as implementing more competition amongst the Medicare Advantage plans themselves. So there's definitely not a clear-cut solution to this.
Now, if some significant changes aren't made to Medicare Advantage, we could be headed down a pretty scary path. As I mentioned earlier, hospitals are jumping ship left and right. You can learn more in this video over here. And I would also like to say that if you are on a Medicare Advantage plan, it's in your first year, and after watching this video,